My name is Thomas Ickham. I am the CEO of the company Medistem. In 2007, we discovered a new type of stem cell called the endometrial regenerative cell. This cell appears to be more potent and easier and more economical to manufacture than other types of stem cells and other types of mesenchymal stem cells. Mesenchymal stem cells are the family of cells to which our stem cell belongs to. Currently, our stem cell is in clinical trials for vascular conditions, specifically for heart failure and peripheral artery disease. Now, since our stem cell appears to be a better quote-unquote type of mesenchymal stem cell, we wanted to analyze what other people are doing with other types of mesenchymal stem cells to see if we should be exploring new uses of our stem cell in other diseases. So we're going to talk about a paper that just came out using bone marrow derived mesenchymal stem cells for treating secondary progressive multiple sclerosis. So what they did in this paper in summary is they looked at 10 patients with secondary progressive multiple sclerosis, patients who have manifestation in the visual pathway, so a distinct subset of patients. They gave these patients on average 1.6 million bone marrow mesenchymal stem cells per kilogram, and they saw there were no serious adverse effects associated with the stem cell administration and what appeared to be statistically significant improvement in visual parameters. So the patients that were analyzed, they had multiple sclerosis defined by the Poser criteria with a specific disability score between 2 to 6.5. The patients had to have optic nerve involvement in order to be eligible for entry in the study. And the optic nerve involvement was defined as having either optic neuritis before, having optic atrophy on examination, having retinal fiber thickness of a specific size, and also having an MRI detectable lesion on the optic nerve. Patients with bleeding disorders, patients who have recently received interferon or Copaxone, or patients who are taking multiple sclerosis drugs were not allowed in the trial. Stem cells were made by drilling holes in the iliac crest in the hip and extracting bone marrow from the hip of these patients. The cells were washed, purified for mononuclear cells, so no red blood cells, just stem cells, lymphocytes, monocytes, and so on, and the stem cell compartment was expanded by growing in DMEM, this is a type of tissue culture media, with 10% fetal calf serum. The cells were then frozen in 10% DMSO with 4.5% human albumin. How the investigators characterized the stem cells was according to the International Society for Cellular Therapy, which means that the stem cells, to be considered mesenchymal stem cells, had to be able to make in vitro bone, fat, and cartilage tissue and express surface markers consistent with the mesenchymal stem cell phenotype. Additionally, the stem cells had to lack pathogens. They were tested for microbiology pathogens and also for mycoplasma before being used, and also tested to make sure that the chromosomes were normal. So it took, on average, 24 days from extracting the bone marrow to having clinical doses. The clinical doses that were given was on average 1.6 million cells per kilogram of body weight in a volume on average of 167 milliliters. Before giving the stem cells to the patients, 30 minutes before, the stem cells were pre-medicated to avoid allergic hypersensitization. This is because the stem cells were made with fetal calf serum. The cells were frozen until use. When they were used, they were thawed in less than 4 minutes and infused over a period of 15 minutes. After the stem cells were infused, the doctors then gave 500 milliliters of saline over a 4-hour period. So it's very interesting because, as we said, the patients are a specific subset of multiple sclerosis. So initially they screened 98 patients. Of these, only 14 were eligible. Of the 14, 3 did not want to participate. And then once they were recruited, there was 11. One changed his mind after being recruited, but before getting the stem cells. So in total, 10 patients received stem cells. There were no short-term adverse events. One had a macular rash 3 hours after infusion, but this resolved spontaneously. Another patient had an itchy scalp 1 hour after treatment, but this resolved spontaneously. 2 patients had infections. One had an upper respiratory infection 3 weeks after infusion, resolved spontaneously. Another one had a UTI, and that was treated with antibiotics and it resolved. More detailed analysis of adverse events showed there was no changes in hematology and chemistry or immunology. The immune response towards common pathogens was not modified in the patients before to after stem cell treatment, and there were no adverse events post-treatment assessed on average up to 7 months. From the efficacy point of view, there was an improvement in visual acuity. This is a test where they perform the test every month, and they looked at 6 months total. Each of the lines, each of the dots here represents a patient, and the red line represents the average of the patients. As you can see, the visual acuity according to this scale improved from before treatment to after treatment. There was a reduction in the visual evoked response latency. So the higher the latency, the worse the visual parameters are. So decreasing the latency is a positive aspect. And as you can see, the visual evoked response latency measured in milliseconds per month was actually decreased in a statistically significant fashion. There was an increase in the optic nerve area measured in millimeters squared per month from before and after treatment. And there was also a statistically significant reduction in the general disability of the patients at 6 months. There was a decrease in the T1 hypointense lesion volume. This did not reach statistical significance, and there were no changes in the T2 lesion accumulation or in general brain atrophy after treatment. So in conclusion, the authors concluded of the 10 patients that were treated that intravenous administration of your own bone marrow mesenchymal stem cells is safe and well tolerated. There were statistically significant improvements in the visual scales and visual parameters assessed, as well as in the EDSS. And the authors stated that there is a good basis for continuing exploration of using mesenchymal stem cells in patients with multiple sclerosis. From the Medistem perspective, of course, the endometrial regenerative cells are a universal donor, so this would be a much easier method of treatment conceptually than using your own cells, where you would have to be making holes in the bone. Thank you very much.